Hello and welcome to my channel. My name is Colleen and I'm a registered social worker and mental health therapist. Today, I'd like to talk to you about how cognitive behavior therapy can improve sleep. Let's begin. Insomnia is a sleep disorder characterized by difficulty falling asleep, staying asleep, or waking too early, resulting in poor quality, non-restorative sleep. Individuals who suffer from insomnia often experience daytime fatigue, mood disturbances, and difficulty concentrating. Symptoms often impact mental health, physical health, and quality of life. Insomnia can be acute or chronic. It is not unusual for individuals to experience poor sleep from time to time. However, if poor sleep starts to impact day-to-day functioning and lasts longer than 3 months, it is considered problematic and medical advice is recommended. CBT for insomnia is a drug-free approach. Before I go into further discussions about sleep, let me explain a little bit about CBT for insomnia. CBT for insomnia is a structured, evidence-based therapy that targets the thoughts and behaviors that sustain insomnia. It gets to the root of the problem. Medications can help with insomnia, but they are considered a short-term solution. CBT for insomnia differs from medication because it offers a long-term solution by focusing on skill building and self-management as opposed to symptom control. CBT for insomnia addresses maladaptive thoughts and beliefs and helps change unhelpful sleep habits. When talking about insomnia, it's important to understand a little bit about how sleep works. I'll start with a brief discussion of sleep stages. Sleep stages are broken into two main categories, non-REM and REM. Stage 1 through 4 are non-REM, while stage 5 is REM. As an aside, REM stands for rapid eye movement, which refers to the back and forth eye motion that happens when an individual is dreaming. Stage 1, the transitional stage between wakefulness and sleep. Heart rate, breathing, and eye movements slow down. It is a very light sleep from which you can easily be woken. Usually lasts only about 1 to 5 minutes. Stage 2 is light sleep, where the body continues to relax, heart rate and body temperature drop, brain activity slows down with short bursts of activity called sleep spindles and K complexes. Stage 2 makes up a significant portion of the total sleep time. Stage 3 and 4 are deep restorative sleep, also called slow wave sleep. Brain waves are slow with high amplitudes, called delta waves. This is the most difficult stage to wake from, and noise may not disturb you. This stage is crucial for physical rest, growth, and recovery. Stage 5 is REM sleep. This stage is when most vivid dreaming happens. Brain activity increases, resembling wakefulness. Breathing rate increases and eyes move rapidly behind closed eyelids. Your muscles become temporarily paralyzed to prevent you from acting out your dreams. This stage is important for memory consolidation, learning, and processing emotions. It also prepares the body to repeat the cycle. Throughout the night, the sleep stages repeat. Each repetition is called a sleep cycle. Each sleep cycle includes all the stages and lasts about 80 to 100 minutes, averaging at about 90. These cycles typically repeat about 4 to 6 times per night. As the night progresses, the deep sleep stages, so stages 3 and 4, become shorter while the REM sleep stages become longer. It is common for individuals to wake up briefly between each cycle. A circadian rhythm is your body's 24-hour internal clock that regulates cycles of sleepiness and alertness. It's a natural process influenced by light and darkness that affects physical, mental, and behavioral changes, including hormones, body temperature, and appetite. This internal body clock tells your body when to sleep, wake up, and eat. The internal clock is a master clock that helps synchronize other clocks throughout your body. This clock runs on a roughly 24-hour cycle and responds to environmental cues, primarily light and darkness. The rhythm helps regulate sleep, wakefulness, hormone release like melatonin, body temperature, and other body functions. Sleep drive is the body's biological need for sleep. How does sleep drive work? Well, sleep drive builds while awake. As you stay awake, your brain accumulates a chemical called adenosine. This chemical makes you feel tired. The longer you're awake, the more sleep pressure builds, similar to how hunger increases the longer you go without eating. Sleep drive decreases during sleep. When you sleep, your body clears the accumulated adenosine, which causes the sleep drive to decrease. A full night's sleep leaves you with a low sleep drive in the morning. Sleep drive and the circadian rhythm work together to control sleep and wakefulness. Your circadian rhythm keeps you alert during the day by balancing out your sleep drive and then signals the release of melatonin in preparation for sleep. Melatonin release is triggered by dim light and cool temperatures. Environmental factors that impact sleep include light temperature, daylight versus night light. Dim lighting triggers melatonin release, which promotes sleepiness. Ambient room temperature. So, daylight temperatures, which are typically warm, versus nighttime temperatures, which are typically cool. A cooler temperature triggers melatonin release. Your surroundings, so indoor and outdoor spaces versus the designated sleep space. So it's important to reserve a space just for sleep only. Lifestyle factors that impact sleep include intellectual stimulation, high stimulation versus low stimulation. Doing activities that activate the brain increases sleep drive. So the more active you are, the more tired you become. Number of hours awake. So 16 hours or more awake versus 7 or 8 for that rest or sleep. Too much rest during waking hours can impact the sleep quality. Levels of physical activity. So high activity versus low activity. Being physically active improves sleep. Also, consumption of caffeine, drugs, alcohol are important to consider. Stimulants and depressants disrupt natural sleep rhythms. Late night use of electronic devices. The light from these devices can disrupt natural sleep rhythms. Also, unmanaged stress. High levels of stress cause feelings of restlessness, rumination, and anxiety, which reduces sleep quality. When discussing insomnia, I think it's important to talk about some of the common myths about sleep. The first one I want to talk about is that everyone needs 8 hours of sleep. This is false. Every person is different. Some people thrive on 6 to 7 hours, while others need 8 or 9 hours, with 8 being about the average. Another myth is that lying in bed longer helps. This is false. Remaining in bed provides some rest, but getting up and doing a light activity will actually help with sleepiness. Another myth is that health problems have no impact on sleep quality. This too is false. Medication, pain, sleep apnea, and mental health conditions all impact sleep quality. A really common myth is that older adults need less sleep. False. Older adults may sleep a little less, but generally everyone needs the same level of sleep. Opposite, younger adults need more sleep. False. Younger adults may sometimes sleep a little bit more, but generally, again, everybody needs about the same level of sleep. Another really common myth is that a person can catch up on sleep. This is false. You cannot catch up on lost sleep. Trying to do so will only increase the difficulties. Another myth is that daytime sleepiness means that a person is not getting enough sleep. This is false. Daytime sleepiness can be caused by a number of factors other than not getting enough sleep. Could be due to stress, anxiety, or simply just being tired. Now I'd like to move on and talk to you about some of the cognitive behavioral therapy strategies that might help. The first behavioral strategy I want to mention is what's called stimulus control therapy. It serves to strengthen the relationship between your bed and sleeping. This strategy suggests that an individual go to bed only when they're sleepy, get out of bed if they're unable to sleep within 20 minutes, get out of bed at a consistent time each morning, use the bedroom for sleep or intimacy only, and do not take daytime naps. The second behavioral strategy I want to mention is what's called sleep restriction therapy. Sleep restriction therapy is a multi-step process that involves limiting time in bed as a means to increase sleep drive and improve sleep efficacy. This method helps retrain the body's sleep system. How does it work? Well, first, you calculate the average sleep time. So you use a sleep diary to determine the average sleep time. In other words, the number of hours the individual actually spends sleeping per night. The second step is to restrict time in bed. Limit the individual's time in bed to the calculated average sleep time plus 30 minutes. For example, if they typically sleep 5.5 hours, they would be permitted to spend 6 hours in bed each night. Wake-up time would remain consistent, while bedtime would be adjusted to match the restriction. The mild sleep deprivation increases sleep pressure, allowing the body to accumulate adenosine, which helps the individual sleep better. The third step is to gradually increase the time in bed. Once the individual's sleep efficacy is consistently higher than about 80 or 90%, the individual can gradually increase their time in bed by about 15 or 30 minutes. This process continues until they reach the desired sleep amount and efficacy improves. There are many lifestyle habits that negatively impact sleep quality. Caffeine is a stimulant, so avoiding caffeine before bed, reducing it throughout the day if you are sensitive, may help with your sleep. Nicotine is also a stimulant, so avoiding nicotine before bed can be helpful. Substances and alcohol can also interfere with sleep quality, so they should be avoided again around that bedtime. Exercise, even exercising late at night, can make falling asleep a little more difficult. Your diet, so avoiding late night snacks because digesting food requires energy and that too can disrupt your sleep. Electronics, well, they stimulate the brain and can make it really difficult to fall asleep. Your environment, of course, is important. So light, noise, the temperature of the room, definitely have dimmer light, reduce the noise as much as possible. A cooler room temperature can help with that natural release of melatonin. Also medications, so some medications can interfere with sleep, so kind of adjusting the timing of those medications if you do find them problematic. Another behavioral strategy that may help improve sleep quality involves reducing arousal. Some counter-arousal guidelines include creating a buffer zone. So start to unwind about an hour before bed. Transition from goal-oriented activities to more peaceful activities. Schedule a worry time. If you are prone to worry, either schedule a worry time or spend a few minutes writing down your concerns. Relaxation practice. Spend a few moments before bed doing a relaxation exercise. Cognitive therapy. If you tend to have a busy mind before bed, take a few minutes to explore your thoughts. I recommend journaling. Mindfulness practice. Use grounding techniques to bring yourself into the present moment. Thoughts and beliefs about sleep can impact sleep quality. Therefore, it's important to identify and challenge negative thoughts and beliefs about sleep. One cognitive strategy to help improve sleep involves identifying and challenging negative thoughts and beliefs. In this process, the individual is asked to examine triggering events, report how those events impacted their mood, identify the exact thoughts they were thinking, simplify those thoughts into overall beliefs, and then challenge those beliefs by seeking out supporting and non-supporting evidence. The final step requires the individual to restructure those thoughts into something more positive and helpful. Here's a quick example of how this tool is used. If you'd like a PDF copy of this worksheet, please feel free to reach out to me on my website. Take a few minutes to just look it over and see how it kind of works. Another cognitive strategy to improve sleep involves reducing sleep-related anxiety. An individual can use mindfulness and acceptance approaches such as progressive muscle relaxation, deep breathing, or paced respiration, mindfulness meditation, and guided imagery. Visit my channel if you'd like examples of these techniques. If the individual feels worried, they can schedule worry time. This is basically setting aside a small time period dedicated to worrying about current problems. And if the individual struggles with tiredness during the day, they can explore other possible explanations, such as inactivity, poor diet, physical health condition, low mood, pain, and even boredom, to name a few. To conclude, I would like to share a few takeaways. First, insomnia is a complicated problem that can be caused by many different factors. Second, cognitive behavior therapy for insomnia is an evidence-based approach that can help. Third, understanding sleep is an important part of learning how to tackle the problem. Fourth, there are simple behavioral strategies that help improve sleep, such as stimulus control therapy and sleep hygiene. Fifth, in more extreme cases of insomnia, sleep patterns can be reset using a behavioral technique called sleep restriction. Sixth, identifying and challenging thoughts and beliefs about sleep is an effective cognitive strategy. Seventh and final, controlling and reducing day-to-day stress and worry can help improve sleep. Thank you for watching. I hope you found this video helpful. If you would like to learn more about me or my practice, visit turneyandwellness.ca. If you enjoyed this video, please subscribe, like, comment, share. Thanks again.